It's consistent with the existing Medicaid practice that gives the states the option of covering abortions at their own expense. And it mirrors practices already in place to separate church and state by ensuring money the federal government gives religious organizations is not used for religious practices. So we're not reinventing the wheel here. And just as current law demands, the bill respects the conscience of both individual health care providers and health care facilities. And once again, it goes further. Our bill not only safeguards a long list of federal laws regarding conscience protections and refusal rights, but it even outlaws discriminations against those health care providers and facilities with moral and religious obligations to abortion. That means if a doctor does not believe it's right to perform an abortion, he or she can say no. No questions asked. Healthcare facilities like Catholic hospitals, which is the largest non-government, non-profit healthcare provider in the country, will continue to have the same right to refuse to perform abortions. Under our bill, at least one plan that does not cover abortion services will have to be offered in each exchange. So no one will be forced to enroll in a plan that covers abortion services. This is an improvement since a current marketplace doesn't provide a similar guarantee. So it's clear that the current bill does not expand nor restrict anyone's access to abortion, period. It does not force any health plans to cover abortion or prohibit them from doing so, period. Why? Because this bill is about access to health care, not access to abortions. I have great respect for Senator Ben Nelson. His integrity and independence reflect on the Nebraskans he represents. His strong beliefs are rooted in his strong values, but he shows better than most that one can be steadfast without being stubborn. Senator Nelson has always been a gentleman whose consideration is a true portrait of how a United States Senator should conduct oneself. Mr. President, I mentioned our underlying bill leaves current law where it is. This amendment, however, does not. It goes further than the standard that has guided this country for 33 years. It would place limits not only on taxpayer money, which I support, but also on private money. Again, current law already forbids federal funds from paying for abortions, and our bill doesn't weaken that rule one bit. I believe current law is sufficient, and I don't believe we need to go further. Specifically, Mr. President, could we have order in the Senate? It's terribly distracting.
Order in the Senate.
Mr. President, as I mentioned, our underlying bill leaves current law where it is. This amendment, I repeat, does not. It goes further than the standard which has guided this country, as I said, for 33 years. It would place limits not only on taxpayer money, which I support, but also on private money. Again, current law already forbids federal funds from paying for abortions, and our bill doesn't weaken that rule one bit. I believe current law is sufficient, and I don't believe we need to go further specifically. I don't believe that the Senate needs to go as far as this amendment would take us. No one should use the health care bill to expand or restrict abortion. And no one should use the issue of abortion to rob millions of the opportunity to get good health care. This is not the right place for this debate. We have to get on with the larger issue at hand. We have to keep moving toward the finish line and cannot be distracted by detours or derailed by diversions. Our health reform bill, now before this body, respects life. I started by saying I believe in the sanctity of life, but my strong belief that value does not end when a child is born. It continues throughout the lifetime of every person. With this bill, nearly every American will be able to afford the care they need to stay healthy or care for a loved one. It respects life. Those who today have nowhere to turn will soon have security against what President Harry Truman called, quote, the economic effects of sickness. It respects life. Those who suffer from disease, from injury or disability will no longer be told by claims adjusters that they never met, that they're on their own. This respects life. It'll help seniors afford every prescription drug they need so they don't have to decide which pills to skip and which pills to split. It respects life. We'll stop terrible illnesses before they start and stop Americans from dying of diseases we know how to treat. It respects life. We'll stop terrible abuses, like insurance companies looking at earnings reports instead of your doctor's report and charging rates that make the health that we want a luxury. It respects life. We will ensure the most vulnerable and the least prosperous among us can afford to go to the doctor when they're sick or hurt, not to an emergency room where the rest of us pick up the bill. It respects life. This bill recognizes that health care is a human right. This bill respects life. The issue in this amendment is not the only so-called moral issue in this debate. The ability of all Americans to afford and get the care, the access to care they need to stay healthy is also a question of morality. The reason I oppose abortion and the reason I support this historic bill are the same. I respect the sanctity of life. This is a health care bill. It's not an abortion bill. We can't afford to miss the big picture. It's bigger than any one issue. Neither this amendment nor any other should be something that overshadows the entire bill or overwhelm the entire process. Throughout my entire political career, I voted my conscience on the subject of abortion. As I said, that decision is based on something personal with me. My vote today will also honor another principle that I believe to the very core, and that I will believe until my very last day on earth. We must make it possible for every American to afford a healthy life. I believe that the compromise in our current bill and the current bill itself fully fulfills both of these moral imperatives. And I believe that when we are given the trust of our neighbors, our friends, our relatives, the privilege to lead, the opportunity to improve others' lives, we can't turn our backs. We can't turn our backs on the tens of millions of Americans who have no health insurance at all, none. Not thousands, not hundreds, not millions. Tens of millions. We can't turn our backs on the many who do but live one accident, one illness, or one pink slip away from losing that insurance they have. Mr. President, one of the most cherished charters this nation has, drafted by one of our most beloved leaders, declared life to be the first among several of our absolute rights. Jefferson put it even before liberty, even before the pursuit of happiness, life. If we still truly value life in America, and I believe we do, if we still truly value the life of every American, we cannot turn our backs on the 14,000 of us who lose health coverage every single day of every week, of every month, of every year in this country. No weekends off, no vacations. How many of the thousands of men, women, and children who today will be kicked out in the cold will next year become one of the tens of thousands who die because of it? If we value the sanctity of life, as I know that we do, and fix what is broken, as I know we must, we won't have to find out. I believe in this bill and what it will do for our country for generations to come, what it will do for our constituents, my children, my grandchildren, and their children and their grandchildren. I'll not support efforts to undermine this historic legislation.